We've just received word from the fleet. They've engaged the Borg.
Welcome to Surfing the Pain. I'm your host, Joseph of Borg. I'm an expert at living with chronic pain, and I come to you every Sunday night at 5 o'clock Pacific Standard Time from Las Vegas. With Christmas only about 10 days away, and many of us not able to be as active as we'd like to in the holiday season, I thought this was a really good time for me to re-air this. It's a well-known phenomenon that around the holidays, the suicide rate goes way up. And it's compounded for those of us who have chronic pain. Maybe we're not able to go see our loved ones. Maybe our loved ones haven't lived up to our hopes for supporting us and being there for us. If you're a chronic pain patient, you know what I'm talking about. I wanted to present this here in the middle of the holiday season as a new video here on YouTube. I had previously aired it on Facebook on my live stream. I feel, although it's not one of the most watched videos of mine, it is what I feel is the most important one I ever made. I made it with the assistance of Dr. Lynn. You'll meet her when I run the clip, and the introduction will be all included there. For those of you who don't know, I started making live streams on Facebook about a year ago. In large part, I had wanted to do something like that, and I had made some YouTube and informational videos about my chronic pain procedures. But what really motivated me to do the live streams was between Thanksgiving and Christmas last year, 3 of my friends committed suicide who had chronic pain, mainly because they lost access to their medication. Again, if you're a member of the chronic pain community, you know what I'm talking about. So I feel this is crucial information. I think it is an open and frank discussion that must be had by the chronic pain community and those of us who have chronic pain. Very few of us have someone we can talk to and be very honest and intimate with, somebody that you can really share with. And that's why I've created the support groups and the pages that I have. If you want to check those out, check out my Facebook page called Joseph of Borg. And I hope you will leave comments below. I think it's vital that we support each other here in the chronic pain community, because not many of us have people that we can really be honest and open with about this very personal and sensitive subject. With that, I'm going to run the clip. I'll see you guys next week. I'm out. Good morning. My name is Joseph of Borg. I make videos on YouTube, and I wanted to come on today to talk about something very serious. I have fantasized about committing suicide. It's out there. It is. You probably have too if you're a chronic pain patient. Don't panic. Don't call the cops to come to my house and check on me. I am not in any danger. I've also fantasized about winning the lottery. I've fantasized about baking biscuits with Brooke Burke. You may have thought about and fantasized about this yourself, and that doesn't mean there's anything wrong with you. Before I start on this very sensitive topic, I hope you'll share this video with other chronic pain patients. And if you have family who just don't understand, maybe this is something you'll want to share with them as well. I really need your help in getting the word out. I'm trying my best to help people. Like Tupac said, it's very difficult to stay alive when you don't believe anybody cares about you or loves you. It's not true. I'm here. I'm trying to help. I want to listen. I want to help empower you guys to help each other. So please share this video about this very sensitive topic that I believe the chronic pain community really needs to have. Given the opiate witch hunt that's going on, it almost feels like a Holocaust all in itself if you're a chronic pain patient right now. So when I very first started making videos, I knew this was one of the topics I wanted to cover. I didn't want it to be the first one because I wanted to get as comfortable as possible on the web and streaming before I tackled such a huge project. Like I said, for those of you who don't know me, I make videos on YouTube about chronic pain. I've been a member of the chronic pain community for years. I have a spinal cord stimulator and a 3-level cervical fusion. I've created 5 pages for success stories for different procedures. I won't go through them all right now. I don't want to lose your attention, and I really want to focus on this topic, but they are pinned to the page here. If you have had success with some procedures for your spinal problems, please share your success stories. Far too few people stick around and remain members in the support pages after they have their procedures if they work well. So it gives people a very skewed view that they never work. All they're left with are these people who have had horrific complications, and it scares them unnecessarily and doesn't give them an accurate indication of how effective a lot of the procedures can or cannot be. I've got a few announcements before we get going on this very serious topic. Lynn, who you're going to meet in a little bit, is going to be working with me. We're creating a website called painhaven.org. The idea being that people who have chronic pain will be able to log in and video chat with other people who understand whenever they need to. I'm excited about this project. I just don't have it up yet. We're working on it literally daily as we speak. I plan to go into a little different format next week, something a little less of a lecture and a little bit more interpersonal, but we'll save that for a surprise next week. I knew I had to do this topic, and I was really spurred to start making videos back in December. I really got off my ass and started with it about January because 4 people in 3 months that I knew digitally, meaning I knew them just over the internet, but had become very close with some of them. 4 people in 3 months took their lives because they lost their meds and they couldn't manage their pain. That's one of the things that motivated me to start making videos about my spinal cord stimulator, because I know a lot of chronic pain patients have never even heard of one. And if they take your meds away, there's not too many other options left to you. So that's why I wanted to do this topic. Along the way, I met Lynn. Lynn's from New York, and I really believe God put her in my path because I could not have found a better person or a better resource for us as a pain community, and specifically on this topic. Lynn has been a clinical supervisor and a guest lecturer at NYU. She's a part-time professor there. She's been in private practice as a psychotherapist for 20 years. She's been in practice for 30 years. She's licensed and board certified as a psychotherapist, and I asked her to do some clips about this topic, and I planned to use them and talk around them, but it very quickly became apparent that I have absolutely no chance to do a better job or be no more knowledgeable than she is about it. So I am really just going to run some clips she made for me, and I'll come back and talk a little bit between them. She's going to give you a little introduction to herself, and I really hope you get a lot out of this. My goal is to help people. I think this is a topic that the chronic pain community really, really needs to discuss, given all that's going on. And without further ado, I'm going to do my best to launch this clip of Lynn, and I hope you enjoy it.
Hi, my name is Lynn Juliana, and I'm coming to you from my apartment in Manhattan, New York, and I just realized that there are going to be planes flying overhead. in this video, a lot of them. I didn't think of that before I moved outside. This is what happened. I was inside my apartment, and I realized it was starting to get dark, and I thought, oh, that's not good. I better go out on the balcony. So I moved all my stuff. I had to bring my pad and my Snapple and my phone and my gummy bears, my sour gummy bears. I had to bring everything with me so that I could make this video about suicide, which is a very intense subject. So I had to bring all my comfort stuff with me, and I had to move a piece of furniture. I haven't opened the balcony up for spring yet, so I had to move a piece of furniture all the way from one end of the balcony to the other, and it was way too much. I don't know who I think I am. I got out of the hospital yesterday. I have this thing on my head because I fell in the hospital. I hope that's not too distracting. I was trying to put my hair in front of it, but then I just wound up with hair in my face, so it doesn't really work either way. But I was in the hospital yesterday. I'm a chronic pain patient, like I know most of you are, and this is just what we do, or it's what I find I do, and I hear other people talking about. Too much, too fast. You see something and you're going to pick it up, or you have to move stuff, and you're just like, well, it doesn't matter this one time because I have to make this video for Joe. Like, so it's just, I'm with you. I get it. So let me get into my video before this turns into a sunset video. But here you have the part of the Manhattan skyline, those two little points. I don't know if you can see straight through the top railing. That's the El Dorado on Central Park West, and the park is right beyond it. So this is real life Manhattan, not a screen. Okay, so who I am, Lynn Juliana Beldegreen. What I do, or what I did, I'm a psychotherapist. I'm a psychoanalytically trained psychotherapist here in Manhattan. I was in private practice for about 20 years, taught at NYU, and I've been homebound for about 4 years because of illness and chronic pain. And I recently got a spinal cord stimulator for chronic pain, and I went online to look and see who was out there to support people and educate people with spinal cord stimulators, and I looked into a lot of people and what they were writing, and I liked Joe. I liked Joseph of Borg. I liked what he had going on. I got in touch with him, and we've become friends, and he asked me to make this video for his YouTube show, and that's what I'm doing. So what I'm doing is I'm looking down at my notes and then remembering what I want to say, and then I'm going to talk to you for a little while because I don't know how else to do this. I've never made a video of myself before. I've been videotaped and I've been filmed teaching and stuff like that, but there's been a teleprompter. I don't know how to do this, so please bear with me. There'll be lots of good information if you can bear with the poor quality of this video. Okay, so I have a long history of working with suicidal people and assessing for suicide, mainly for two reasons. One is because my specialty is treating sexual abuse, mostly in children, teenagers, sometimes in adult women who have recalled sexual abuse or never wanted to deal with it or weren't able to deal with it well in the past. So there's a lot of trauma there, and the suicidality rate for that patient population is high. But also because I did my final internship in graduate school at NYU at a psychiatric facility for children and adolescents. And really, why would you send a child or an adolescent to a psychiatric emergency room unless you were pretty sure they were going to kill themselves, or they tried to kill somebody else? So that was a solid year of really doing nothing but assessing for suicidality. So I have a lot of experience with suicide, and actually I've decided to call this video my Holocaust Pills video, because at the end of this video, the fourth section of it, this is the first section that I'm almost done with. There are 4 sections, and the fourth section is why I call it my Holocaust Pills video, and also just my experience with suicide and where I'm at with it. And I think that that's got to be one of the most unique perspectives you could get, because I'm looking at it through the lens of a clinician, and I'm also looking at it through the lens of a chronic pain patient who has thought a great deal about suicide and has even sort of planned for it. And I'll tell you more about that a little bit later in the video. So that's who I am. I think I'm probably the best person to answer some of your harder questions about this topic that I know Joe is very, very right away. He wanted to bring this to you, and I think that that's fantastic. And you can reach him, and he'll reach me, and we can get all your questions answered to the best of my ability, which is a lot of ability. So I'm here for you guys. And again, I'm Lynn. My name is Lynn. So okay, that's what I wanted to talk about in part one. Okay, so part two is I wanted to talk to you a little bit about suicide. I know a lot of people don't think it should be illegal to take your own life. I think that's a personal choice. I have personal opinions about that. I believe it to a certain extent. I think the laws exist because the fear is that people will make a rash decision during a time of crisis. Or will be trying to stop the symptoms of a physical illness or a mental illness. I'm not going to throw a lot of statistics at you in this video at all, but I will tell you one statistic. The one statistic that I feel is important is that the National Suicide people, who are the biggest people in the industry that have accurate information, because not everybody has accurate information at all, but that have accurate information, and the number for you, if you want to call them or if you just want to have the number around, should be on the screen somewhere, or Joe's posting it, I know that. The statistic is that 90% of people that have successfully committed suicide have had a diagnosed or undiagnosed physical or mental illness. The physical illness you would be able to tell obviously after autopsy. The mental illness an undiagnosed mental illness you would only be able to know by the reports that were the closest people to that person talking, and then everybody realizing, oh, those are symptoms, or bringing it to a professional after the fact to kind of try to diagnose it. So 90% of people. So it couldn't be more clear that people are doing this to end pain. People are doing this to end pain. They don't want to be in pain anymore because the symptoms of a physical illness or a mental illness, if they're serious enough, cause tremendous, tremendous pain. So it really is the only common act of such a magnitude that we know of that is specifically to end pain. That's it. And that's a lot of what the controversial opiate crisis is about. But that's another video, and I know Joe has a few on that one too. Okay, so if you think about it, we're talking about people with physical illnesses. There's a lot of people with physical illnesses that get to the point where they're in chronic pain, or possibly terminal, or both. Certainly both if they're terminal. There's also a tremendous amount of people that have a psychiatric diagnosis, even if it's not one of the big ones like bipolarity or schizophrenia, or the ones that we all, hear about a lot, even if we haven't had personal experience with them, either with ourselves or with somebody in our lives. There's no question that all of those psychotic disorders, all of those personality disorders, all of those mood disorders absolutely create serious symptoms that could lead to the kind of pain that would cause people to commit suicide. But there's also ones that people don't think of as much, things like substance abuse. Substance abuse is a psychiatric diagnosis. That causes suicide all the time. People don't want to deal with it anymore. It's almost impossible to recover and become a completely, either substance-free person or someone who's learned how to live with whatever level of substances work for them in their life. Almost impossible. So there's a lot of people in their lives because they just can't take the consequences of being an addict anymore. And then there are also psychiatric diagnoses like trauma. Something horrible will have happened to someone and they just will not be able to get past the flashbacks and all of the ways that trauma affects your life. And that's what I've seen mostly. I've seen the suicidal effects of trauma. So there are a lot of reasons that you would want to stop a massive amount of the population from committing suicide. So I can understand why it would be illegal to a certain extent. The other reason is because of adolescents. Adolescents get suicidal, and that always needs to be stopped, really. well, I'm not going to say always, but I'm going to say under almost any circumstance, because adolescents' brains aren't developed enough yet to be able to make the decision without it being questioned as it being an altered decision. And really what all of this is about, and what I'm going to talk about in the next part that's coming up in a second, is that suicide should not be contemplated when you're in any kind of altered state. And that goes for a lot of types of altered states. And I'm going to talk about that in the next part. But first, I am going to talk to you just about... I'm just going to talk to you about suicide and what is on the continuum or the spectrum of suicidality. So basically, the continuum or the spectrum of suicidality involves 3 different states of being with suicidality. The first, I should have brought a note card for each one. Well, they're not that hard to remember. I'll go over them again. The first one is called Suicidal Ideation. That's when you're thinking about it. The second one is called the Suicidal Gesture. That's when you make a gesture. I'll explain that in a moment. And the third one is a suicide attempt. So suicidal ideation is actually very common, especially in all of the populations I just mentioned, especially if you're trying to deal with some kind of enormous pain, whether it's physical pain, emotional pain. It's probably both, because I can't really imagine one existing without the other. But you're probably thinking about it, you've probably thought about it, and the thing that I like to tell people right off the bat is not only is it not uncommon, it's not a bad thing. I'm going to take my glasses off for this part. It's not a bad thing to think about it. It's really not. It's actually comforting. And when you realize that it's not uncommon, it's unfortunate because you can't mention to people that you've been thinking about it. So that's where it makes it a little bit uncommon. It may feel kind of strange because you can't just mention to, your mom if she comes to visit, or your best friend on the phone, or whatever it is. You can't just mention, I've been thinking a lot about suicide, even thinking about how I might do it. That's alarm people. So you can't really mention it, and that might feel odd about it. But really, it's very common, and it can be very, very comforting just to know that it's okay to do it, because it's very common. It serves a purpose. It's comforting, and it's okay to think about it. It really is. I can tell you that unless you move into the next 2 steps, which would be to make a gesture, which we take a little bit more seriously, or an attempt, it's really okay to think about suicide. It really is, especially if you understand now that a trained professional is not going to think that you're suicidal or crazy if you say you've been thinking about suicide. Really, we don't get that alarmed, because really almost everybody does, and especially people seeking therapy at a particular time. And I can talk to you more about seeking therapy and getting a therapist later or at another time, because I can tell you an easy way to get a great therapist, because most people don't know how to find a good therapist, or they think it's going to cost a fortune. It doesn't. There's a way to. I'll talk about that later, or Joe will remind me to make another video about that. Okay, so let's move on to the gesture, the suicide gesture. So what a gesture is it's a very, very big and important step in between the ideation and the attempt. A gesture would be something like going to Google and looking up how many pills of a certain medication are lethal, or it would be looking up on Google, how high a height do you have to fall from. It's actually doing something about maybe some kind of plan, or it would be getting your box of pills. Everybody has a box of pills, right? So getting your big box of pills that's been prescribed to you by everyone for everything forever, and going through them and sorting out what might be lethal, what might contribute to the handful of pills you're going to take to kill yourself with, and which ones might not, and then maybe even count the ones that look like they could be lethal or cause some kind of crisis in your body that would be enough to kill you. That's a gesture. maybe somebody that's considering slitting their wrists, and they've heard that there are different ways to cut their wrists. Maybe take a blade and just kind of just sort of run it there and just see, something like that. So those are varying degrees. Taking the bottle of narcotic medication that you'd probably have a pretty bad response to if you took the whole bottle, especially if it's at the beginning of the month. If you get narcotics when you first get it, it's a pretty full bottle. Taking that bottle and bleeding it out as opposed to keeping it away where you usually keep it, something like that. Those are gestures. The reason that gestures are significant is because if someone is having gestures, it's definitely time to be talking to somebody just to figure out, how close are you to moving towards an attempt. If you are, you may not be, but if you're not, why is it moving from ideation to gesture? You might just want to figure that out with someone. It's important to find somebody, and this is again something I was going to talk about a little bit later, but it's and then everybody, I guess, knows what a suicide attempt is. So it's ideation, gesture, attempt. Those are the three on the continuum of suicidality. Those are the three places that one could be at. So an attempt is taking an attempt. The difference is it's with intent. Somebody might say, "Oh, she made an attempt, but she didn't really make it. She didn't really want to kill herself. She told me she didn't really want to kill herself. She just took some pills, but then decided not to take any more." All right, well, that's a gesture, and the intent is questionable, and we have to assess the intent when the person is more lucid or not altered in any way by medication that they may have been given at the hospital or to mitigate the attempt or whatever it is. So that's it. There's and with an attempt, there's always intent. There's always intent. So that's the difference. Intent is the difference. Okay, so I think here comes part 3. I'm going to do this all in one shot, or you really are going to see the sunset, I think, which actually could be nice. Okay, let me just, actually, I'm going to...
Well, now that you've met Lynn and heard what she had to say, I wanted to talk to you a little bit about my opening statement. It's not just me. I recently was on a program with somebody called the Grow Boss. He took some time out of his busy day and his show, how he makes a living, selling stuff and helping people who want to grow marijuana at home. He was a huge inspiration watching him make his videos for me to make mine. I figured if he could do it, I could do it. I've watched him battle tech problems like mine too. So shout out to the Grow Boss. If you want to learn about growing cannabis, he's your guy. But unprovoked and unprompted, he talked about the danger zone of 2 a.m. to 6 a.m. where he really struggled with wanting to kill himself due to the pain. He's got back issues. And if you want to hear more about the Grow Boss, or you want to hear his story in his own words, go back to my previous video, which is episode 3, and he's about the last 15 minutes of the show. So I think Lynn is a huge asset. I'm going to run another clip of hers in a few minutes. I would really like to make her a steady feature, not just about suicide, but if you have questions for her and her area of expertise, or just questions for her in general, you can either send them to me at josephofborg@gmail.com, or you could just post them here on Surfing the Pain, and I will make sure she gets it, and we will try to make her a weekly feature. That's a lot of information, but now that you know that I'm not crazy and you're not crazy just for thinking about killing yourself, especially if you are a chronic pain patient. The reason I called it a fantasy, that I've fantasized about it, is it's just like every other fantasy in life. Maybe you fantasized about going someplace on a vacation, and when you get there, it ain't what it was in your mind. If you fantasized about somebody you'd like as a partner sexually, generally, if you ever get the chance to get with them, it doesn't quite live up to the hype in your mind. Similarly, in a similar way, I have a fantasy of how it would go down, and I know it wouldn't go down anything like that. In my mind, when I imagine it, my wife and I go down to a Caribbean beach. It's sunset. We're sitting watching the sun go down in a couple of nice lawn chairs, sipping umbrella drinks, and I start washing back Percocet 2 at a time about every 20 minutes until I just quit breathing and she gives me a kiss on the cheek to say goodbye because she's ready for me to go, and she wanders off to find the authorities. And I know that's bullshit. I know it's going to be shrieking anguish. She's never going to be ready, and it's not going to go down like that. But as Lynn is going to touch on in her next segment, it was very empowering to at least admit it was an option. It might be an option I found distasteful, might be an option I choose not to take, but it made me feel less trapped, and it made me feel like I took my power back, and it freed me from feeling like a victim. Lynn's going to touch on that in this next segment. Stick around and check it out.
Okay, so here's part 3 and 4. I paused after part 2 because I wanted to look back through my notes and see if there was anything I forgot to say. And really, the only thing I forgot to say, surprise, surprise, this is not at all a Freudian slip. I forgot to say, I wanted to say what was wrong with me briefly, because I think it's important to know who you're learning from in terms of you're all pain patients. I'm assuming most of you, or maybe some caregivers, are watching. Actually, that wouldn't be a bad way to introduce this subject. Show this to your caregivers, so people that you might want to mention that you were having a really, really bad day and thinking about ending it all, they can see that just thinking about it is really normal and okay. But I wanted to mention, I've been homebound for 4 years. So I've been living in a 656-foot square apartment with an almost that size outdoor space. I have a huge outdoor space. It's a weird apartment, high up on a roof in the sky, and I haven't been out except to go to the hospital and to doctor's appointments, which is often, but still, it's a problem, and I definitely won't treat anybody while I'm feeling like this, even though the first year or so I probably could have kept working a little bit longer, but I wasn't in the right head, and now I just I was in the hospital because I suddenly can't walk again because I have a weird disease in my legs. I have MS. I collect rare autoimmune diseases. Well, MS isn't so rare, but the rest of them are. So I've got all kinds of weird things wrong with me. I've been to Mayo. They told me that they really had not seen this before. They kind of gave it a name and said that I would need much more extensive workup, so I could have either stayed there living in Minnesota or come home and tried to find more good doctors in Manhattan, which is what I did, and we're getting somewhere. But I've been home for 4 years, and I have been in serious pain, and I'm going to talk about that in the next part, which is why I call this my Holocaust Pills video, which just makes a really good point. But before that, I'm going to tell you, you definitely don't want to talk about gestures without you don't, because really gestures are talking about, are you really planning for this, and that's a really, really scary question. But if you're there and you've really thought about it, you definitely want to talk to somebody about it, particularly a professional, because they know how to talk about stuff like this. That being said, I don't think all therapists are created equal. I'm actually embarrassed about my profession a lot of the time because there are some really, really bad therapists out there. I'm telling you, and if some of you have been to therapists that have either been, on your insurance plan, or that you've found at, some kind of place that sort of provides counseling, I'm sure you've run into them. But there is a way to get a really, really good therapist without spending a fortune in most areas of this country, and I'm happy to do another piece about that. But you want to find somebody to talk to about this. The most important thing is that they're impartial, which a really good therapist will be. A really good therapist will be impartial. But if it's not a really good therapist, anybody that you think can handle being impartial, because if you're going to discuss whether or not you're planning for this, and if you do decide to plan for it, like I did, I planned for it, and I'll tell you more about that in a minute. You want to make sure that you don't do it when you're in an altered state, that you do it when you've run through some kind of checklist that the person that helped you plan for it has helped you make. Those are all really important things to consider. It's like the metaphor that I was thinking about is if you decided to take a cruise somewhere and you got on a cruise ship, and after the cruise left the port or the dock or wherever it is they leave from, you found out that there was a 50% chance that ship was going to go down, you would really make an effort to learn about all the life-saving equipment on that ship. You would make sure that you checked out the life vests and that you knew how to use the lifeboats and that there were enough of them and that, there was a plan, and you would spend a lot of time and energy figuring out how you were going to survive because you found out there was a good possibility that your life was going to be at risk and you didn't want to die. So if you're thinking about suicide as a possibility at some point during the rest of what would be your natural life, you want to plan for it, and you want to make sure that it's definitely not a mistake. Because I can't think of anything that would be worse than that. Really planning for it and being ready and feeling like it would be a better thing, and then it not working out, either because you didn't stick to the plan and you did it when you were wasted, or you did it when you were panicked, or something like that. So that being said, let me tell you about my experience, my personal experience with suicide. I don't know why I'm looking at this piece of paper, probably to remember what I want to make sure I don't forget to say, because this is tough stuff. Even for me, it's tough stuff because I'm talking about myself now. So the most important thing that the person that helped me go through this, what I decided, how do I start? Okay. What I decided for myself was that there was a certain kind of pain that I was just not willing to ever experience again on a regular basis. There's a certain kind of pain for me that's like a level 9-10 pain. I know the scales mean different things to different people. Joe and I actually had a conversation about this the other day, and we were talking about how, people that, first of all, none of the scales are the same anyway, so it's like, what scale are you using? But those pain scales from 1 to 10 are really controversial. I mean, for me, if I'm in level 10 pain, that means I'm probably not able to speak, not able to tell you what's going on, quite possibly unconscious. And when I say everything from 9 and down, it's relative to that, because I think that's the only way they can really grasp exactly what you're dealing with. And I know, I was just talking to Joe about this, we were talking about so many people, they're like, oh, the pain's like a 15, and you can't really say that to doctors, because they're not going to take you seriously. They're certainly not going to medicate you correctly, because no doctor is going to over-medicate you, so they're just not going to take you seriously, and they're probably not going to medicate you at all. But that kind of, for me, level 9-10 pain is just, if I had to do it a couple of times a year, that would be a lot. But if I had to do it more than that, and there have been months, like 2-3 months at a time, where I've had to deal with that on, a regular basis, like a weekly basis. At least 2 to 3 days out of the week were like that, and I was being rushed off to the emergency room. That I would not, if I knew that that's just what my life was going to be like, that's when I would seriously consider this. But what I realized for myself is that the pain is more of a fear of it getting to that level 9 or 10 pain and not being taken seriously enough and not having enough medication to take care of it on my own. That's my biggest fear, being sort of left in pain. In fact, I know that Joe has metaphors that he uses to talk about his pain. One of them is surfing the wave, which is what you've all seen on his channel. And another one that he uses is this monster that you have to, sort of constantly, not poke at and keep in check and cater to, and this whole metaphor about a monster. I think that my thing with pain is just what actually happens when I'm in so much pain that I absolutely want to die, 100% want to die, would rather die, and I feel like it's not being managed properly. I completely withdraw into some kind of, usually a corner, anything that surrounds me the most where I am, because I feel like, and here you're going to see the analyst in me, I feel like being in a corner sort of surrounds you as much as possible with the something, because people aren't being supportive and surrounding you in the proper way if you're in that much pain. But also because it feels sort of punitive, like the way you would put a bad kid in a corner, right? Or it's because I think that there's a lot of shaming that comes with serious chronic pain. So I tend to just sort of retreat into a corner. I'm usually kind of dissociated. I'm usually in some kind of fugue state. Those are obviously not ideal times to kill yourself. If you're in any kind of altered state, if you're dissociating from pain or emotions, and if you're not sure what dissociating is, we can make a video about that. So when you lose time and place, you forget blocks of time, you sort of come to and you realize you're in a different spot. You don't really remember how you got there. That's sort of dissociating, or sort of being on the ceiling watching yourself be in pain, or watching yourself be abused as a child, which is where the term comes from, being dissociated like that. These are all altered states, sort of the same way substances are an altered state, or alcohol is an altered state. There are lots of different kinds of altered states. You don't want to do this or think about doing this when you're in an altered state. It's like there's an expression, some of you may have heard of it, don't figure your life out when you're on cocaine. And if you've never done cocaine, I can tell you the reason that that people say that is because cocaine makes you feel sort of invincible, and you've got the world figured out. You can do anything, and you're omnipotent, and you're grandiose, and you're just, everything is brilliant that you're thinking, and this is a great plan, everything's going to work out. And then when you come down from the cocaine, you're like, oh wow, it's a good thing I didn't really go with any of those ideas, because I didn't think of any of the downsides or whatever. So that's why people say that. And this shows where there's truth to that expression. You don't want to make any decisions about anything like this if you're altered in any way. That's why having a plan is essential. So what I did is I decided that if I was going to kill myself, I was going to use pills, because that's what feels the least torturous to me. And at this point, my pain has tortured me so badly, I just don't want to be contributing to that. And I don't want to do it in any kind of way that would hurt, because I don't want to hurt anymore. So I don't want to slice my wrists or shoot myself or do anything like that. I decided pills would be best for me, and I decided that I was going to figure out a way to get my hands on enough of a certain kind of medication that I knew absolutely would be 100% possible. And it took a while, but I got my hands on that medication, and I put it in a jar. I would bring it and show it to you, but it's in the apartment. But I put it in a jar, wrapped really, really tight, sealed with tons and tons of tape, and it says "do not eat" on the jar. It would take you a really long time to get it open anyway, and if you got it open, you would see that there was a Ziploc bag in it with enough pills to kill myself. And the day that I got through the few sessions that I had with the doctor that I chose to work with to talk about all of the things that you should talk about before you make a decision like this, I decided that there were lots and lots and lots of things that I needed to be absolutely sure about, and he and I actually made a checklist. We made a long list of all of these things that if I was going to do this, and it's right there with the jar in the refrigerator, so the pills don't lose their efficacy, because that would be the most tragic thing of all. But there's a long list of things that I just want to make sure. I want to make sure I'm completely sober. I want to make sure I've called these 2 people. I want to make sure that all these things are taken care of, and all of these things are not happening. And if I can't check off everything on the list, I'm going to try my best not to do it, because I knew I decided when I was in a very good, very sober, very lucid state to do that. So the day that I created all of this, and I finished working with that doctor, and I got the pills together, and I made the thing, and I put the tape, and I put it in the refrigerator, was the day, I can't even tell you, it was the day that I became free. I'm not scared of anything anymore, really, and and I don't think I'm likely to ever use that, but I know that if things change, I potentially would have to, and that would be sad, but I know I would want it to be there for me to use if things did get that bad. So I think that you should get help deciding with somebody when is it for you that it's gotten that bad. Make a checklist, have a plan, whatever the plan is, and make sure that it's not something that, God forbid, anybody else visiting your house can get their hands on, just like you lock guns up, whatever you lock up, or do what I did with, don't ever eat this. And I live alone. I don't even think I would do this if I didn't live alone. I don't think I would leave it in the refrigerator like that. I would figure something else out, but, obviously something, and just have a plan. And if you need help figuring out who to go through this with, or if you are interested in getting a good therapist, I highly recommend it for 9,000,000 reasons. And knowing Joe, he will ask me to do another short video on how to get a really good therapist for not a lot of money, really almost any place in the country, because it's really, really possible. It can be done. So I'm happy to share that information. All right, that's it. And I'm realizing I chose the wrong backdrop, because look at what's happening on the other side of the sky. Look. There you go. So it was a sunset video after all. Okay, bye. Okay, so I realized I forgot the most important, well, maybe not the most important part, but I forgot to say why it was called the Holocaust Pills video. So now I'm in my kitchen, so I can actually show you what I was talking about. But the reason that it's called the Holocaust Pills video is because I'm a first-generation Holocaust survivor. My mother was born in the Holocaust, and my whole family was raised with a Holocaust mentality. I think over 100 people in our family were killed, and it's just been a big part of the way that I was raised. So all of my family members are relatively sensitive to it. And I was talking to my aunt that I'm the closest to, and I was trying to explain to her what a bad day I had had, and I decided to just take a chance and say, I actually, I stashed away enough pills to kill myself, and I've got a plan, and if this, goes south for a few more years, it may be what winds up happening. And she was like, she was absolutely horrified. Of course, I mean, who wouldn't be horrified hearing that about a relative? But then I said to her, but it's like the Holocaust pills that our relatives, had stashed away and took, when they were on the trains and stuff. They knew what they were going to face if they got to the camps, and a lot of them had pills, and in case they needed to commit suicide before they got there. Really, it's like the same thing. And she thought about it for a minute, and she went, oh yeah, and it was totally okay with her. That was it. It was fine with her. So I think a lot of it has to do with a good metaphor. But wait, let me show you the pills. Okay, see, here's my jar. Has a danger sticker on it, and it says do not eat. And this is the jar that the day that I got this put together and got the okay from the people that I was working with to put it together, that's the day that I was free, because like I said, I don't think I'm going to use this anytime soon, but it really helps me to know that I have a solid plan with a very long list of things to check off before I would even open this jar. And it feels really good to know that it's an option. Okay, that's really the end of my video. Okay, so I realized I forgot the most important, well, maybe not the most important part, but I forgot to say why it was called the Holocaust Pills video. So now I'm in my kitchen, so I can actually show you what I was talking about. But the reason that it's called the Holocaust Pills video is because I'm a first-generation Holocaust survivor. My mother was born in the Holocaust, and my whole family was raised with a Holocaust mentality. I think over 100 people in our family were killed, and it's just been a big part of the way that I was raised. So all of my family members are relatively sensitive to it. And I was talking to my aunt that I'm the closest to, and I was trying to explain to her what a bad day I had, and I decided to just take a chance and say, I actually, I stashed away enough pills to kill myself, and I've got a plan, and if this, goes south for a few more years, it may be what winds up happening. And she was like, she was absolutely horrified. Of course, I mean, who wouldn't be horrified hearing that about a relative? But then I said to her, but it's like the Holocaust pills that our relatives, had stashed away and took, when they were on the trains and stuff. They knew what they were going to face if they got to the camps, and a lot of them had pills, and in case they needed to commit suicide before they got there. Really, it's like the same thing. And she thought about it for a minute, and she went, oh yeah, and it was totally okay with her. That was it. It was fine with her. So I think a lot of it has to do with a good metaphor. But wait, let me show you the pills. Okay, see, here's my jar. Has a danger sticker on it, and it says do not eat. And this is the jar that the day that I got this put together and got the okay from the people that I was working with to put it together, that's the day that I was free, because like I said, I don't think I'm going to use this anytime soon, but it really helps me to know that I have a solid plan with a very long list of things to check off before I would even open this jar. And it feels really good to know that it's an option. Okay, that's really the end of my video.
I'm not sure how I really can follow that. It doesn't get a lot more real than that, and I knew I could count on Lynn to bring that to you. That's my goal too, to be here and be very real, because sometimes I feel like I'm screaming into the darkness trying to help people. So I really hope you'll share this video with other chronic pain patients and people who need it. I'll see you guys next week. Thanks so much for tuning in. Joseph of Borg, signing out.